Hello everyone, this is me Jasneet Kaur. Welcome back to my channel. Before discussing today's topic, please don't forget to like, share and subscribe my channel. I request you to press the bell icon to get the notifications about my next uploads. So today's video would be about chapter 3rd, Public Nutrition and Health. This chapter would be divided into two parts. This video is part 1. Part 2 link you can check out in the description box below. Make sure you watch this video till the end. Let's begin with understanding the learning objectives of this chapter. After the completion of all the topics of this chapter, you will be able to understand the significance of public nutrition, knowledge about various nutritional problems, understanding of factors that are linked to nutritional problems, different strategies for tackling nutritional problems, and different programs operating to tackle important nutritional issues. So let's start one by one. In class 11th, we have already understood the importance of healthy diet. By now, we all know healthy diet or good food is the foundation of good health. Whatever we have covered, it was from the individual perspective. But now, talking about public nutrition, what it means. It is a concept where the collective action taken by government or by the members of the society to protect or promote the health of mass or whole population. In class 11th, we have also discussed about different categories of nutrition, undernutrition and overnutrition. For your reference, I will explain it again. Undernutrition is a condition when there is insufficient intake of energy and nutrients. And overnutrition is a condition when there is excess of any nutrient in the body. Now the question arises, why do we need to study this specific aspect in nutrition? It is important to take a look on this topic because malnutrition is the major cause of 50% death among children of 5 years. The statistic shows an alarming situation in our country. Almost 1/3 of infants which are born in India are low birth weight, means they born with less than 2.5 kg to 3 kilograms, which is considered to be a normal birth weight. The other reason of studying public nutrition is majority of preschoolers who belong to socio-economic disadvantaged families suffer from mild or moderate undernutrition. Another reason is most of children and adults suffer from micronutrient deficiency. It is important to overlook these issues and find suitable solution because with increase in number of these cases, the impact is not only visible on the physical growth but also on the cognitive development of the children. India mostly faces the problem of undernutrition, but from the last few years, as there is change in the eating pattern of the people, dietary habits are changing. Youngsters are getting more inclined towards junk food, high sugar, salt, and fat, low consumption of fiber rich diets. Sedentary lifestyle is contributing a lot in making the situation worse. All these practices further leads to obesity, heart attack, hypertension, arthritis and much more severe acute and chronic diseases. Thus, India is said to face the double burden of malnutrition. So, public health nutrition is the field concerned with promotion of good health through prevention of nutrition related illness and with the help of government policies and programs. Talking about public health nutritionist, a public health nutritionist is an expert in diet and nutrition who work to improve the public nutrition habits instead of working one to one with individual clients. Public health nutrition work on large scale, organized and multidisciplinary approaches to solve the problems that affect the population. Hence, this field is known as multidisciplinary in nature and built on the foundation of biological and social sciences. It includes the concept of social sciences as this field addresses the problem of community. For your reference, community is a specific group of people who share common characteristics, example, a common language, exposed to similar conditions, common lifestyles, or the same health problems. I hope students you all are paying attention to the content. For further clarity, make sure you watch this video till the end. Continuing to the content, for promoting good health, professionals needs to identify the problem and its impact on the lives of the people. Then why and how these problems occur, and afterwards professionals needs to plan strategies and action plans to implement them. Once the plan will be implemented, then evaluation will be done to check the impact of that plan. In lot of areas, nutritional problems are not only linked to food, but there are variety of reasons. Most of the times situations get worse due to lack of basic amenities. For further clarity, I would recommend you to check out the table mentioned on page number 74 of your NCERT book. You will see the basic cause can be lack of finances, lack of funds from the government, poor environment, poor status of women, and much more. At household level, you will see insufficient access to food, poor care of mother and the child, improper basic sanitation, insufficient access to basic healthcare services, discrimination against girl child, elderly, and lack of education. At individual level, you will see that people themselves are neglectful towards maintaining healthy eating pattern, or they themselves are suffering from any sort of disease. The outcome of such conditions is malnutrition, any form of disability, and even death. Now we will pay attention on the various nutritional problems in India. Majorly in India, two types of nutritional deficiencies are pretty common. First is protein energy malfunction, which is also known as PEM, and micronutrient deficiency. Beginning with protein energy malnutrition, it is caused by inadequate intake of protein and energy in the diet in comparison to the actual requirements. It can occur at any age group, children, adult, and elderly. Also, in some diseases like tuberculosis, AIDS. It can be assessed by evaluating the anthropometric measurements. The example of this can be marasmus and kwashiorkor. Marasmus is caused due to the deficiency of energy, and kwashiorkor is caused by the deficiency of protein. There are three terms used to define the condition of the person: underweight, stunting, and wasting. Underweight is when the body weight is less than the actual weight of his or her age. Stunting or short stature when the height is less than the actual height as per the age. Wasting is when the weight is not adequate in relation to the height. Moving on to next one, micronutrient deficiency. It is defined when the person has lack of essential vitamins and minerals required in small amounts by the body for proper growth and development. The other term which is used to refer micronutrients deficiency is hidden hunger. Examples in this can be included like deficiency of iron, vitamin A, iodine, zinc, vitamin B12, folic acid, calcium, vitamin D, riboflavin, etc. Let's discuss some of micronutrient deficiency in detail. First one is iron deficiency anemia, IDA. It is most common type of anemia. It occurs when your body doesn't have enough of the mineral iron. Majorly, it can be found in women in childbearing age, adolescent girls, pregnant women, and school going children. Symptoms of this kind of deficiency can be like fatigue and tiredness, shortness of breath, depression, hair loss, brittle nails, increased sensitivity to cold, frequent headache, and restless leg syndrome. Maintaining good iron health will support immune system, energy levels in the body, prevents anemia, support muscle function, promotes healthy pregnancy, prevents restless leg syndrome, maintains good mood and support proper mental growth. Moving on to second nutrient deficiency, vitamin A. It occurs when there is less intake of vitamin A in the diet. It is required to maintain normal vision, epithelium growth, and immunity. If it is not cured at the right stage, it may further leads to blindness. Deficiency symptoms can be like dry skin, dry eyes, dry lips, night blindness, infertility and trouble in conceiving, delayed growth, throat and chest infections, poor wound healing, acne and breakouts, bite spots, impaired immunity, thick or scaly skin. Moving on to last deficiency, iodine deficiency disorder or IDD. It is a condition where iodine level in the human body is not appropriate. Along with other health impact, insufficient amount of iodine leaves impact on the proper functioning of thyroid gland. Symptoms of deficiency can be observed like thyroid imbalance, goiter, swelling in the neck, unexpected weight gain, fatigue and weakness, hair loss, dry flaky skin, sensitivity towards cold, change in heart rate, trouble in learning, problems during pregnancy, and irregular periods. I hope students I was successful enough to make these topics clear to you all. With this hope, I would like to end this session here. There are few questions mentioned on the basis of the topic covered. Make sure you complete it in your notebooks to check your level of understanding. Don't forget to share your views about the video in the comment section below. I will see you soon with my next video. Till then, take care of yourself. Bye-bye.